Welcome, viewers, to another episode of Panel Talk. We are going through crisis time. There is pandemic across the world, and India in the past few weeks has been affected. And the one that is raised to the occasion is the healthcare segment. As they say, during crisis, there are opportunities. It pushes mankind to come up with new ways of facing the crisis. What we have seen in the recent past is some disruptive ideas coming up. And one such idea is delivering medical supplies using drones. We have heard of drones, but the role of drones to save lives is something unique and new. My panel this week to discuss this topic of future of healthcare and technology, Mr. Vivek Tiwari, who's the CEO of Medica Bazaar. It's India's largest B2B platform, e-commerce platform that supplies medical supplies directly to hospitals and clinics. My second guest is Dr. Amresh Rao Malapati. He's a cardiothoracic vascular surgeon. He heads the department at Nizam Institute of Medical Sciences. He's also done his advanced management program in healthcare from ISB Hyderabad. And then we have the drone man, Mr. Prem, who's joining us from Hyderabad. His company, Mark Drone, has been awarded, is going to be taking part with Telangana government in the pilot project called Medicine from Sky. Welcome, gentlemen. Welcome to the show. Let's start by understanding, Prem, do you want to talk about the program that you're going to be part of, where your company is going to work with Telangana government in the Medicine from the Sky program?
So what exactly we are planning to do is with a helicopter, we are trying to bridge the healthcare gap from a district medical hospital or a warehouse to a PHC. So majorly what we are trying to do is delivery of the medicines, vaccine, diagnostic samples and blood for 50 to 80 kilometers stretch from a point A to point B. So through our technology and through the hardware, we're trying to bridge that gap at present. And we were the first company to demonstrate last year for the technology and the platform to DGCA and to the government of Telangana. And after that, they released the EOI for Medicines from Sky, and we've been selected for Medicines from Sky project with the government of Telangana and Volcanic Forum. And so we've in Vikarabad district, we are going to do the medicine and vaccine delivery from a district hospital to a primary healthcare center in the month of June.
Coming to you, Vivek, I would like to understand. You are a best, person to understand the challenge of getting, medicines from one location to another. And could you share what kind of challenges do you face, when it comes to delivering medicines, medical supplies, especially when it comes to rural India, remote parts of India?
Absolutely, very valid question. And let me start with the fact that any medical delivery or medical supply, it can't be substituted. It can't be, it's not about any fashion product. It's not about any other e-commerce product. So medical supplies in India is always need-based. It's always needed at the time when it is required, and you have to reach there. That's how, especially we look at healthcare delivery model, and we look at the supplies opportunity in the country today. The reason why we are still facing those challenges, and happy to hear more from Prem on what he's doing in terms of the entire drone delivery model in medical supplies, because of the certain challenges in logistics, certain challenges in timeline. I can tell you, we keep on getting multiple calls on our helpline where people need as on delivery today. Let's take an example, and no better than the doctor here on the panel can really tell you, when he needed something urgently for the patient to be delivered today, he needs it as on today, because the patient life will not wait for 3 days or 5 days for someone to get some critical products or supplies. And this is what we have been facing every day in, day out, kind of. I can tell you, from AIIMS, we keep getting calls that I need some product tomorrow for a surgery tomorrow morning. And if the product is lying in Bangalore, and there are times it is lying in Chennai, there are times it is lying in somewhere other places, or I'm just telling, few weird distant locations. But it might be that even if the product is, say, 100 kilometers apart, it is very difficult for someone to just carry that product and give it to the hospital in such a short time. So at times it becomes really difficult for us to look at the challenges associated with critical nature of the products we are dealing with. Whether it is a vaccine, whether it is a blood product, whether it is certain critical surgical interventional products. It might be a basic stent to a say critical surgical, kind of mesh catheter, any kind of products which might be needed at time of whether surgery is done or whether the patient is being treated. It is needed then only, and you can't delay that. So this is where it is very, very time critical. It is a life-saving product. That is why I said the nature of product is that it can't be wait. It can't be in a nature of waiting period for 3 to 4 days. You can wait for your shirts or trousers to come after 3 days, but you can't wait for your medicines to come after 3 days. So I think that's where it makes a lot of difference in the type and nature of products we are dealing with. Today, I tell you, in pandemic, we kept getting, calls from everywhere. People want concentrator in 3 hours. Its concentrator is a 30 kg item, right? How can you deliver it in 3 hours from one location to another? So I'm telling you, these are when it is needed the most. You can't challenge that fact. So this is where, I think a model like drone delivery, or a model like instant delivery, or a model which can reach inaccessible places or locations in India is the need of the hour, because our country is so large, with more than 650,000 villages, with 700 plus districts, with people all around, and all types of terrain in our country, whether it is a hilly terrain to any kind of plains we talk about, to seaside we talk about. We have everything in this country. So this is where I think it is important for us to explore this kind of a medical delivery, model in India.
Dr. Amresh, coming to you. When you talk about blending technology, today technology is touching every part of, our lives. It doesn't matter where we are or what profession we are in. With your experience, having been, you're also now, an expert through healthcare management. How important is, bringing technology into healthcare, especially when we talk about something like a disruptive drones?
Healthcare has always been threatening to bring in disruptive technology, but that has never happened really. It has never really taken off. So what the pandemic has now done is it has put it all on an accelerated mode. So if at all disruptive technology has to smash its way into healthcare, this is the time it has to happen. There is definitely no doubt that adoption of technology has its own challenges. There have been a lot of medical legal issues. There have been certain regulatory issues, definitely. But definitely nobody doubts the need of disruptive technology. Medicine has always been dependent heavily on personnel. It has been very personnel intensive. And for everything, we have been depending on persons. So, be it, of course, face-to-face interaction has always been the cornerstone of medicine, center stone of medicine. But then, if you look at nurses, nursing people actually spend more time documenting than in offering nursing services. You have ward boys taking samples all across the place. There are so almost everything you say, you give it to a person and assign a job and you expect them to do it, right from finding a bed, right from clearing their bills. It has been too much personal intensive, and what this pandemic has done is it has made it very important to protect the personnel, and it has said, look, now you dealt with people enough, get in technology where role of people is limited, and increase your efficiency and get value for everybody. We were just talking about medicine delivery or delivery of products. Till now, we were in a situation where doctors used to call the shots. I know I had medical representatives stand in front of me and say, एक तो sample, दो sample तो करा दो महीने का. Now I am having to beg them for samples, beg them for the medications. This is an unprecedented scenario. Where were beds available? There are plenty of beds available now. Now we have to search each hospital for a bed. So what it has done is it has suddenly made it important that everybody should have a value, create a sense of value in the entire system. There should be value not just for the doctor or the patients, but also for the payers, for the providers, and for the ecosystem in large. So definitely, I think technology helps. And when you look at something like drone technology, we are looking just right now maybe at just delivery of essential items, or maybe transport of organs, or these things. But if you look at me, it has a much bigger role to play. Because I would always, given a country like India where resources are scarce, and you would like ideally you would want every village to have each resource, and look at it this way, that a hospital is a sum of parts. So there are several units which should make up a hospital, of which out of 1 to 10, I might need only 1 or 2. So now if I have to cater, if I need, I can't build 100 hospitals in 100 villages, but definitely I can have 200 units where whatever unit is required can be transported to that particular place for that particular time. So I see tremendous role in it. If you think that by conventional thinking we might reach there, then it might take a little bit of time. But always disruptors have come from outside the system. So I think it's high time somebody from outside the system disrupts the whole thing, and think the whole way we think of hospitals, think the whole way we think of delivery of goods or essential items, or how the logistics are panned out. I think it's time for somebody outside the system to think of it.
So Prem, clearly, as Dr. Amresh says, somebody from outside had to come and disrupt, which you are doing. Are you ready? I mean, it looks like the medical fraternity, the healthcare workers, and people like Mr. Vivek, they're all giving thumbs up to your service. Are you as a drone man and your company ready to take up the challenge?
Yes, we've been ready. We've been ready from last 2 years onwards itself because of the regulations, a lot of the challenges from the regulatory bodies and everything. We've been waiting for it to do it. And because of COVID, it has accelerated that, like the need and the trust on the drones have been increased and everything. So we are anticipating that at least in next 1-2 months, many states, like not only Telangana, many other states gonna come up with a first pilot study and feasible study and bring a roadmap how to they could use drones in a longer term, year-long kind of activity. And so to give you a context is like today, all the mad rush of people coming to the hospitals, to the urban cities or to the private hospitals is happening because our healthcare systems in the rural areas have been dependent on the government. And when we saw, like example, our government system has the tertiary, secondary, and primary centers, and majority of tertiary centers have equipped with pharmacies, blood banks, and the proper the diagnostics and the proper the theater operation theaters and everything. But it comes from secondary and from primary centers, they don't have 100% kind of infrastructure, so they can't maintain the medicines or diagnostic samples or do them there. So that's why people have come to the tertiary centers and come to the cities, and as you see, the whole people are medical fraternity have been challenged to cater this kind of the need and everything. So what we are trying to do is we wanted to strengthen the existing healthcare system. That's where majority of people are in rural. That from a district hospitals to a primary health centers is what the keen interest is. How could we bridge that so that we could make it more accessible and the quality of service and affordable for the people, so that a person in a village, he's near to a PHC, he can avail the blood or long-tail medicines, because majority of people in Telangana have these snake bites. They need a long-tail medicines in less than half an hour, 45 minutes kind of a thing. And you'll be surprised, like still there are many deaths happen in Adilabad district because the pregnant woman, because of lack of the quantity of blood during her pregnancy and everything. So these are very simple things. If you can able to give the needy medical supplies and everything in 30 minutes or 40 minutes of the golden period, I think we're going to save someone's life. That's where we're trying to keep all our efforts towards. So because airspace is shorter than what we see on the road, and we're very confident because we have built 5 kgs, 10 kgs payload kind of drones which can go for 50 kilometers and 80 kilometers. So we're very confident that we will able to cater and we will able to bring that the confidence to the government and to the medical fraternity that drones could become more enabler for them to do their existing things.
So Prem, the likes of hospital like Medica Bazaar, who will be primarily the suppliers to your companies like yours, Prem, where you'll be picking up the medical supplies and then probably delivering to the likes of NIMS and KIMS and other hospitals. What kind of changes or infrastructure change, addition or change they will have to do at their level so that your drones can go pick up the medical supplies and then deliver them?
So with the drones, what our drones can also, example for our existing 10 kgs drone can have a 4 temperature control boxes where you can maintain for different temperatures. Like blood can be maintained at different temperature, vaccine can be maintained at different temperature. So already with the hardware, we have equipped with the temperature control boxes and everything, which can maintain like 3 to 80 degrees Celsius kind of a thing. Like companies like Medica Bazaar and everything, because they already have streamlined the supply chain. What we're trying to, this becomes a more extension to their service to provide in a shortest time and to cater to the demand and supply what has been created in the market at present, from a warehouses to the hospitals, or from a central point to a more of a distribution points and everything. It becomes in shorter time and in a very reliable kind of mode of a transportation is what I could see going forward.
So Vivek, your company, Medica Bazaar, have you started, thinking on these lines that in a couple of years, probably drones would be one of the modes through which you will deliver your medical supplies? If yes, what has been the thought process within your board?
So absolutely, Medica Bazaar has always been, I would say, early adopter kind of a business model, right? We always want to do something which we feel could be the future and which we feel could be the problem solver or enabler for the business what we are into. Last year, in fact, we were the first company to sign up with Zipline. Zipline is the first company in the space. So this was heavily covered in the PR and media. Medica Bazaar and Zipline were the partners to explore this drone delivery model in Maharashtra, say for the initial rollout. And this was a kind of a effort by Government of Maharashtra and Serum Institute of India. We never knew that pandemic would be in such a scale or a state that all these projects would be shelved and people will be more concerned about saving life at this point in time. But this was done primarily early 2020. And this is where our talks started, and this is where we thought that we would first enable and get into rural areas in Maharashtra. But there are others also, like there are companies like Red Wing Labs, there are companies like CD Space, there's company like Soup Arrow from Australia, which were trying to come in. In fact, Marut is one recent addition, and our team has been in touch. But overall, situation was coming to a point that we were thinking of actually getting into this model, trying to explore the opportunity, and we signed up with Zipline to begin with. Though this is not taken off completely for obvious reasons, because the government permissions and all are required, because this is a very sensitive space and there would be multiple challenges associated. There are security threats and all of those areas where government is working on it. But I'm sure this will be given a very strong nod from the government to operate in certain locations. I'm sure Telangana government has been up on the curve, and they have been trying to do this very strongly. There are other governments who are thinking about it, other state governments, but this is where we think we are working with various providers and trying to see what best we can do, because we already know the complexity of product, the nature of the product, what Prem rightly said about different product management, temperature control. And we have an in-house team looking at all of this. What we really need to look at the infrastructure base and support, because somewhere we believe that drone management, while is it easily spoken, but there is a good amount of infrastructure needed. There are takeoff infrastructure needed. Especially you have to create a hub sort of infrastructure where you need to put drones there, and you need to make sure that there's a takeoff point, and from there you can reach out to the different destinations or locations in different areas. Though I'm not a drone specialist to comment on that, but again, just telling you exactly what we have learned from industry, what we are trying to get from different sources. So this is where I think we are, kind of becoming an early adopter in this space, knowing the fact that it has taken off quite well into markets like Africa, where in countries like Rwanda or Congo, Zipline has been successful in terms of bringing down the turnaround time for blood samples and HIV reports for patients, especially the young children. I think this will be a great help for a country like India. As Dr. Amresh was telling, we are having dearth of resources everywhere. So this kind of a model has to be really a great model for an enabler for healthcare in our country, largely.
Yes, we had met the Zipline team in Hyderabad when they were visiting here. We did a show with them. Dr. Amresh, NIMS is a premier institution, and it has been always at the forefront of anything to do with with the healthcare. Has your team and your organization started thinking on lines of using drones in future?
Major Sunil, disruptive technologies, first of all, require a change of mindset, and they require a regulatory framework to operate in. One thing I know is that at least whenever you have a change, you need either early adopters or at least advocates and early adopters. And definitely NIMS has people who have that kind of progressive thought in mind, who are willing to try out these things that, hey, this looks good, this brings value, let me try it out. And as far as regulatory framework is also concerned, our chairman is the chief minister of the state itself. We have the health minister and the various policymakers on our executive board. So definitely we can try it as a pilot project with us. It gives us it definitely gives greater access to we have both adopters of technology as well as the ability to influence the regulatory framework as well from the medical perspective.
Thank you, gentlemen. Thank you for joining us on this panel talk, and we look forward to hosting you. Thank you, Vivek. Thank you, Dr. Amresh. And thank you, Prem, for joining us. Thank you.
Thank you all. Thank you. Thank you for inviting us here.